The Hindu editorial dictation heading is the systematic invisibility of women's midlife health. Get ready? Start. India's focus on women's health during their childbearing ages has been one of its most significant public health achievements. The maternal mortality ratio has fallen from 362 per 1 lakh live births in 2000 to about 80 per 1 lakh in 2003 through the National Rural Health Mission and subsequently the overarching National Health Mission. Several initiatives expanding institutional deliveries, skilled birth attentions, better antenatal and postnatal care have enabled these outcomes. This work is still ongoing since access to safe pregnancy, childbirth, and reproductive autonomy is highly variable across the country. However, women's health does not conclude when childbearing years past. The decades that follow, when autoimmune conditions emerge, begins cardiovascular risk and cancer incidence increase, receive far less structured attention. In policy practice and perception, these years remain largely invisible as India's disease burden shifts to the increasing prevalence of non-communicable disease. Women in their 30s and 40s are experiencing higher rates of chronic disease such as hypertension and thyroid disorders, with 106 per 1000 women reporting at least one NCD compared at 65 per 1000 men. Health and social blind spots. The invisibility of women's midlife health is embedded in the way medicine diagnoses and treats disease. For example, women experience heart attacks differently from men with symptoms such as fatigue, nausea, anxiety, or back pain rather than the classic chest pressure or pain. When the widely communicated default system symptom profile is made, women's emergencies are likely to misread or detected late. Some midlife conditions that are more prevalent among women, such as autoimmune disorders, frequently present as generic system symptoms like fatigue, cognitive fog, and diffuse pain, and are therefore not often investigated clinically. Historically, conditions that affect women differently and disproportionately have received less research attention and therapeutic innovation. The speculum used widely in examinations has not evolved since it was first invented in the 19th century. These blind spots extend to the design of objects and spaces in everyday life. Women are biomechanically different from men, carrying their center of mass lower in the body. Yet chairs and desks at the workplace, protective equipment, and rehabilitation devices are designed around a male default. In addition, the social realities of women delaying medical help, privatizing family responsibilities, and dismissing early symptoms further reinforce this invisibility, resulting in late diagnosis and more complex treatment. Addressing these invisible aspects of women's health needs a shift from focusing narrowly on specific stages to adopting a life course approach, which recognizes the impact of early exposures, lifestyle factors, and social determinants over time. India has been laying the foundation for a life course approach by extending health and wellness centers beyond maternal services to include prevention and management chronic disease, population based screening for breast and cervical cancers by the NHM is a step towards recognizing the health risks that emerge in midlife, broadening the program to include conditions such as anemia and autoimmune disorders, along with greater awareness of the symptoms, could significantly strengthen early detection and care for women. However, the promise of these programs will depend on the deployment of sufficient frontline capacity and resources. As India strengthens its pharmaceutical and medical device innovation ecosystem, there is an opportunity to address long-standing gaps in women's health research and diagnosis. For generations, women have been conditioned to prioritize the health of their families before their own. True to this, Women's Day's theme, Give to Gain, one must encourage vigilance among the women in our lives to pay more attention to their bodies. Investing in women's health is more than an act of equity. It is an investment from which families, workplaces, and the economy stand to gain. Satya Sriram is healthcare strategist with over 2 decades of private and public sector experience. Stop.